Nearly 1 in 5 U.S. adults suffer with some form of mental illness, depression, schizophrenia, anxiety disorders, bipolar disorders, and substance use disorders. Unfortunately, in our region, we do not have good access to psychiatric care for these patients.
It's a big challenge for people in this area to get psychiatric care. We have an inpatient psychiatric facility in Darlington, and there's 2 full-time inpatient psychiatrists there, and those are the only inpatient psychiatrists in the area. There are some other outpatient services available, but there's just way more demand than there is supply for these types of services.
Psychiatric care is something that has been very minimal in Clarendon County over the last several years. Although we see a growing population, we're seeing more patients here more frequently. We're seeing younger patients every day. A lot of those patients are return patients. We may see one patient 3 to 5 times per month if they are in acute crisis. We have very little public transportation processes in Clarendon County, so even if there is care available in nearby counties, a lot of our residents don't have access to transportation to go to those outlying resources for care.
Now, telehealth has opened up a whole new world for us with access to care. By providing telehealth services, we can help meet people where they are. This brings help to them in their own homes, in their own hospitals, in their own communities.
Tele-psychiatry enables us to connect with patients using a video conferencing platform, whereas the traditional method involves the psychiatrist being physically present at the bedside to complete the evaluation and perform any consultative service.
So essentially connecting us through a cart that is pushed to the patient's bedside by the bedside nurse. She remains in the room while the psychiatrist and the patient are interacting with one another, mostly to observe as well as to make sure that technology doesn't fail us during that time. The physician and the patient interact with one another, answer questions, have conversation, and the physician is able to directly observe the patient's responses as well as their affect during that interview.
No family history either?
No, not that I know of.
Are you taking any medication?
The treatment plans depend on the actual patients, and we always say that patients don't read the textbooks, and every patient is different, and I think that's one of the benefits too of having a psychiatrist through the telehealth see patients, because they can individualize that care.
They don't have to be physically there to examine the patient. So you think of the ability for limited psychiatrists in this country, if they can sit in their own office, in their own home, and provide these services way more frequently than they would if they had to commute or if they had to go, multiple facilities. It's just very, very beneficial that they can get those services right here in our medical center without physically having to be here.
Having telehealth psychiatry services is important not only for our adult patients, which is what I primarily take care of on a daily basis, but I think for the pediatric patients as well. We're seeing mental health issues in younger and younger populations.
Our youngest recorded behavioral health patient has been a 9-year-old. So that population is growing, and we need to be sure that those patients have access to care.
The use of telemedicine in psychiatry enables McLeod's patients to receive timely, cost-effective care in places where they otherwise may not be able to receive it.
One of the patients that was seen by a telehealth consult had been there for months and was able to get out of that facility and into a place where they really needed to be within a week of having that tele-psych consult.
The biggest benefits for tele-psych here at McLeod Health Clarendon is that our patients have access to the care that they deserve. We can treat them medically, we can treat them surgically. We do have a gap in providing psychiatric care for our patients, so it's allowing that patient to have access to the care that they deserve.